meeting started. If the computer will quit making noise. Why? Oh, that's why. Hang on, let me turn off my email. Otherwise, it'll
That's
drink.
mine.
Oh, it was yours. Okay, Mike. Okay, that didn't work. Hang on, guys. Broadcasting today from the health department, in case you're wondering, and I think we've got all the technical issues worked out. Do we have any public part? Oh, I'm so used to looking for you here. Julie, do we have any public participation?
None that I know of. Nothing was forwarded to me.
Okay. And could you call the roll?
Yes, ma'am. Allen Ginsberg.
Here.
Andrew Held. Absence. Carla Pohl.
Here.
Corey Tello.
Here.
Anna Eisner.
Here.
Judy Buchanan.
Here.
Richard Giannetti. I don't see him. Robert Cole Hayes. Did I do it
Here.
wrong? Okay.
That's perfect.
Okay. Scott Hume. Sonia Reese.
Here.
And Susan Schaefer.
Here. Scott was on here. I know he has technical difficulties sometimes.
Okay.
Yeah, he'll probably join us shortly, Julie. That seems to be a technical problem he has.
Okay.
Yeah, I saw him on also. All right. Okay, so your minutes from our regular session on February 10th were in your packet. Do I hear a motion? Judy. Second, Sonia. Any discussion? All right, all those in favor? Oh, sorry, roll call. I can't do that anymore.
I know it's rough. Mr. Ginsberg.
Aye.
Ms. Tello.
Aye.
Ms. Eisner.
Aye.
Ms. Buchanan.
Yes.
Mr. Cole Hayes.
Aye.
Ms. Reese.
Aye.
And Ms. Schaefer.
Yes.
Okay, motion carries. Our next item on the agenda is the consent agenda. We have bills that are listed in your packet. Do I hear a motion?
You do.
Sonia? Hannah, second. Any discussion or questions? All right, Julie, are ready for a roll call?
Mr. Ginsberg.
Aye.
Ms. Tello.
Aye.
Ms. Eisner.
Aye.
Ms. Buchanan.
Yes.
Mr. Kohlhaas.
Yes.
Ms. Reese.
Aye.
Ms. Schaefer.
Yes.
Ms. Pohl, did you want to vote on that?
Yes,
Thank you.
motion carries. Our next item is under informational items, and we are going to hear about the contact tracing COVID-19 call center sustainability plan. And that's in your packet on pages, I don't do that, 3, what?
3 to 19.
Most of it's on 3. Is Tammy, Tammy? do you want to kind of walk us through some of the high points? I realize it's self-explanatory, but
Sure. Are you hearing me?
Mhm.
Okay, because for some reason my computer keeps telling me I'm muted. So basically what Jessica and I and the contact tracing program coordinator have done is come up with a plan to continue on with some staff beyond the grant cycle. Because as we all know, the battle will not be completely won against COVID-19 May 31st. So what we tried to look at was kind of bare bones staffing, what we think we need, likely for like the next 6 months, as it's indicated in your packet.
are there any questions? Oh, I'm sorry, Sonia. Oops.
I see two plans, Plan A and Plan B. Would you like to comment on those?
What I did was give 2 options just to kind of get a little bit of input from you all about what you all thought would be doable. And then Jessica has more to add as far as funding the positions, but we wanted to at least start with 2 choices of what that might look like.
Do we have funding that would accommodate Plan A? I mean, do we have a plan on how to get funding? I guess that's
Right, so-
kind of nodding.
Yep, so I had to go through a little bit of technical issues here to make sure that we didn't get any feedback, but IDPH has let us know that there will be an amendment coming to our current grant for an extension through December 31st, where we can use any of the funds remaining in our grant. So that's what we're looking at now, is kind of projections to see what will be remaining that would get us through past May, from May to December, and what the difference would be, because we can also then ask IDPH for that money and tell them what our plan to use it would be. So whatever the difference would be, we can ask IDPH. I can't guarantee they would give it to us, but that would be then what we would bring back here to the board to ask for. So yeah, there will be an opportunity for us to utilize the funds remaining in the contact tracing grant. So at the end of May, whatever is left, we can keep using that. And then what is the difference? That's what we would have to figure out. And then where would we get the difference from?
So going on the plan that you're operating under now, is it your estimation that you could hit May and still have 536,000? No, she's shaking her head no.
So we will
Is it
still
the grant?
have, yeah, my estimation is we'll still have some funds, but it won't be the full amount that we would need for either of these plans. So we would still be a little bit short, but I don't have the exact amount yet. So we're looking at it right now.
Okay. You're looking at what's going to happen between now and end of grant time. And will we know about it then in our next meeting, or what's your ask of us tonight?
So our ask is just, looking at Plan A, Plan B, what the difference would be. We can bring you next month a better projection of where we expect to end. So at the end of May, how much money would be left? And then we can re-examine also Plan A and Plan B again to see, but just any feedback you guys have on what's presented before you.
Sorry, Susan. Susan, go ahead. Sorry about that, guys.
I'm waiting to be called on. My question is, between the end of May and December, is the need going to be there to have Plan A with the 25 versus 21 and the difference in the funds that we'll have? Because technically what they're reporting is that the vaccine will be out and many more people will be vaccinated. And is that demand for that much contact tracing going to go down? We'll still have that because of variants and things like that and whatnot, but is that demand going to be there? And I guess that's a question that you can't really answer right now, but I think that we have to consider the vaccination numbers maybe in another month or so.
So part of that plan is to have all staff cross-trained in contact tracing and call center, because while vaccination efforts continue, the call center will continue to be involved in helping people get scheduled, answering all the calls that come in about when's the clinic, where's the clinic, what do I need, things like that. So that's why we wanted staff cross-trained so that we can fulfill whatever need is currently happening.
Judy, did you,
No.
so,
My question was more about the timing, but I think Jessica's addressed it. We're going to look at this again, probably at least one, if not two more times. Yeah, thank you.
at least. Corey, go ahead.
If we go with the lesser numbers, can we not change it if the need arises? I mean, you know what I'm saying? It's like, how flexible can we be? Or is there an urgency to have it budgeted so that there's not so that we don't have to suddenly scramble to find the money? Or could we go with a lower amount, assuming that if the need is there, we will of course add whatever staff would be necessary? Just your
And
thought.
I guess I could. Yep, sorry. Okay, so I guess I could speak to that. We have individuals on staff, they're trained right now. So and we've had difficulty hiring contact tracers. So that would be my only concern, is if we dropped it down and then needed to expand, it hasn't been that easy. So we would then have to also train them, and we have a group of individuals. So these individuals would be people that we would just keep on.
Thank you. That makes very good sense. Okay.
And also at the time that we were working on these plans, we weren't sure that the grant would be extended and where the money would come from. So we were looking at kind of cost effectiveness if we had to, dig up the money from somewhere.
Anna?
Okay, and yeah, I sense that, this is going to be a moving target, and we'd love to think that by December, we don't need them, but so if I understand this correctly, the current grant is extended till the end of December of this year. Is that right? Is that what you said, Tammy? Okay, so we're looking at something as of January 1. And how many contact tracers and call center people do we have now? How did your proposed numbers compare to the current staffing?
As it turns out, they are all cross-trained right now. So there isn't a specific division between call center staff and contact tracing staff. But we have, I think, between 40 and 45 people total.
That's what I was thinking. So and I don't know, I'd be interested in knowing what your recommendation is. It looks like there's the difference is a position of a team leader. So certainly tell us what you think.
What it boils down to is, of course, the extra supervisory type positions or team lead positions will allow for things, extra things like auditing of contact tracing, constant supervision and training of call center staff, managing outbreaks. Right now they are managing everything that's happening with schools. And so those are the leadership type things that are happening. Could we do it without the extra leadership staff? Yes, but it would be tough.
And just I comment, it looks like then that this will overlap our budgeting process since we're going to carry the grant through to the end of the year. So I would think that what we would want to do is as we begin reviewing budget, it'd be appropriate at that time to look at where we stand with the remaining grant monies and what other sources of funding there would be, whether fund balance or some other source. So it could be part of our budget. And you don't have now, do you, any idea how much time past December or into January, into 2022 we'll need people? I mean, I'm sure you have a crystal ball ready to answer that question. But these numbers are based on continued need and with the assumption that in January of next year, this is what we would need staff-wise. Is that what these are? Okay.
Any other questions or comments? Tammy, this is excellent. Thank you very much. We really appreciate the guidance. I'm sorry. Did you guys hear me when I said that? I can't tell if I knew. All right. Sonia, you ready to do that?
On mute. The Behavioral Health Coordinating Council is set to meet on Friday, and we're expecting the agenda to come, but as of about an hour ago, I had not received it, so stay tuned. We'll see. Susan, have you gotten yours? He's looking. Yeah. No, she doesn't get hers either. So we'll brief you next time.
Okay, thank you. Mental Health Advisory.
Okay, so the Mental Health Advisory Board met on February 22nd, and we went through a guided discussion in our effort to get their input on issues and needs that the 553 board should be thinking about prioritizing, and specifically, what to address, how to address those needs, what are we aiming for based on their what they're seeing in their work, that they are in the trenches people, and we really value their input. And we asked them to look at what needs were already there that they were concerned about before the pandemic, and then which ones have kind of sprung up because of the pandemic, and obviously which ones are kind of the overlap that have been compounded by the current crisis. So not only the pandemic, but social justice issues, et cetera. We had an excellent flow of ideas. That is a very, just a very informed, caring, passionate group. And they really got into collaborations that we should be thinking about and action steps to think about. So while as a 553 board, obviously we are charged with mental health and substance use prioritized issues, it continues to be evident, and it was very much highlighted during this meeting, that there's such intersectionality to all of this. The issues that were already evident, like that create the mental health and substance use issues, of course, are access to stable housing, access to healthy food, access to transportation, access to stable employment. Those all impact so much the physical and mental health needs of so many McLean County residents, and particularly those in certain zip codes and socioeconomic groups. So the three areas that really came forward from our very rich discussion were stable and safe housing. But again, we really tried to recognize what's already there and what can we kind of tap into to think about this. And of course, we have the United Way Path Housing Coalition that I think everyone knows about, is made up of the Bloomington and Normal Townships, the City of Bloomington, Mid Central Community Action, PATH, the Salvation Army, and the Town of Normal. And of course, even that includes McLean County Regional Planning, Prairie State Legal Services, some churches, the Immigration Project, et cetera. So we talked about how we would, we could work collaboratively with them and the Bloomington Housing Authority, landlord associations, et cetera. So again, just things for us to be thinking about. The second area was suicide prevention with particular attention on youth and the elderly. Again, we know that we already are doing, Project Oz already does Ending the Silence, and that gets into every school in the county. And they certainly offer trainings to other age groups and populations, but not to a great degree. We also looked at our mental health first aid, how that would help with this. And we did today, just point to note, there was a mental health first aid training today. And there's another one coming up on the 24th. That one's for youth. We also looked at how we're going to intersect with, in terms of the whole suicide prevention, focusing on youth and elderly. We talked about how we would intersect with Area Center on Aging, ARC, Faith in Action, senior housing, continuing obviously to work with school districts. Plus, we also know that way too many youth have disappeared from the school community during remote learning. There's just so many students that are not showing up. That's not a surprise to anyone. And school resource officers have really been called to and have really risen to the work of doing outreach to try to find and reconnect with those kids. But we're going to need so much work on re-engagement efforts and finding out the true status of where those kids are at in terms of their mental health and just general functioning. And then the third broad area we talked about was re-entry into the community when people are coming out of the justice system. A particular need that was highlighted and which has been there is the need for psychological and psychiatric services. But of course, those needs are exacerbated by the things I've already talked about: difficulty getting housing, employment, case management, transportation, et cetera. So again, we talked about who's already working on that we should be talking and thinking collaboratively with. And that, of course, is the Behavioral Health Coordinating Council, the Criminal Justice Coordinating Council, looking at the Criminal Reform Bill, looking at the Illinois Department of Juvenile Justice, the Illinois Department of Corrections. But of course, they really have no money for those kinds of initiatives. And then the County Board Justice Committee. So, one of our members, went so far to talk about just some steps we should be looking at for these people, like screening and post-arrest services and alternatives and transition. So all of that. So again, those were the big three: were housing, suicide prevention, and reentry into the community. But again, we talked about we should be looking at models of what other communities and states are doing, which of course we already do, but expand that. And we've got some mental health advisory members that are very invested and knowledgeable, particularly about that reentry from justice systems, that are very willing to gather some research on that. Tricia Malott, who is an ad hoc member of our committee, also indicated that she and her staff might be able to assist in some of this work, and as well as Taylor Davis, our own behavioral health specialist, to kind of begin doing some of this research. So, the other somewhat good news, of course, is that there was some funding that was released from the United States Treasury that President Biden released that's supposed to go out for, I gotta find out exactly. Let's see, I got it here. Sorry. All of a sudden I've forgotten exactly that's earmarked for housing. That was $25 billion coming out of the US Department of Treasury. And then our proposed Illinois budget, if it is what it should be, they are proposing a net increase for Department of Human Services, which would be an 11.3%, and that would be up 3% from last year. And also in the Illinois budget, $22 million for behavioral health special projects is in there, and that would be an increase of 11 million, so almost double what was last year for those special projects. And then for substance use prevention and recovery, there's a proposed increase of 23%. So that would be wonderful. And obviously other things we continue to would look at would be SAMHSA grants, and emergency rental assistance through the federal U.S. Department of Treasury. So I could go on and on. There was lots to think about.
Sounds like you had a very productive conversation. Thank you, Corey. Does anyone have any questions or discussion? Okay, our next agenda item is County Board. Susan.
I don't really have anything.
All right, and Behavioral Health Policy and Funding Committee, Hannah.
Well, as I mentioned last time, we are not meeting until the end of this month, so we don't have any report at this time. There is a report in the packet from Amy in terms of the year-end stats for the funded agencies. So I'd ask anybody who had any questions about that would like our committee to review, to forward those to me. And I guess I'd suggest that we could do that as opposed to having a long discussion tonight, if people are comfortable with that. But since I have the floor right now, I wondered if I could circle back, and I'm sorry, note taker, to the question of the staffing. You know, do the mass fact one, and Jessica, maybe you'll address this later. I didn't know if the county would be getting any more money for vaccination clinics with the new COVID bill from Congress. And is any of that money usable for our call center staff who are involved in helping people make appointments? And I didn't know where we were paying for the people who are kind of managing that site. I know IT has been trying to help us with the sign up site, but I assume there's a considerable amount of staff time being devoted to that.
So the funding that I presented last month is 440,000 that we're applying to IDPH for. That's all that we've been notified about yet. I can't say that that'll be all that we would receive. Within that, the only support to the call center was some phones, so equipment, supplies, and I think, again, the technology needed to really beef up the the call center to support the volume of calls we were receiving, but no personnel were included for the call center in that.
Did that answer your question, Hannah? Okay. All right, now we're going to do the administrator's report. Give me a
All right, so just wanted to bring your attention back to page 4 through 19 is the COVID-19 funding overview. So requested last month was just a kind of summary of the money that we have received so far or will be receiving in the case of the mass vaccination money. Just a summary of kind of where we are with those. And I included the work plans and budget summaries for each of those just to give you kind of an overview. So I don't know if there were any questions about those or anything else in my report.
I have to unclick twice.
No.
Okay, Judy, go ahead.
I don't have a question. I just want to say congratulations that the state of Illinois National Guard has identified us as a model site for vaccinations, which it just goes to your credit and the staff for getting things together. And as we've been saying all along, we're ready to really vaccinate a lot more people. We just need the vaccine. So good work done, Jessica and your team.
Susan?
And I'm going to kind of follow up on that. I'd like to thank Senator Barrickman and Representative Brady for the work that they've done to help try to get more vaccines for McLean County so that we can actually run that many through, that we can actually go through that the arena. So they were very helpful with our conversations with IDPH, which you kind of all got a little summary of. And we'll see what the future brings.
Mhm.
Hannah?
Thanks. And thanks, Jessica. This is very helpful to have this laid out so we know what this money is doing. And I guess questions and kudos again to how well we've done this far. I know I've been very fortunate to get a vaccine, and many people I know have. And when you hear the numbers out there, you go, wow, really, really fortunate to be in a community where so many people are still getting access, even though there's some frustration. On that line in your report, you mentioned, and I know we had the town hall and then the vaccination event at Mount Pisgah. I didn't know if there was any reports on the numbers of people who we got vaccinated there, but you indicated in your report looking at alternate sites. And I wondered if we're also looking at different hours as we increase our clinics to make it, more accessible to people who may not be able to get out during those peak hours of the day.
All right, so we got an extra shipment of doses this week. And so we opened our first Saturday clinic this Saturday, which is exciting. So really the expanding hours and days of the week are contingent upon getting vaccine. So the Guard teams can run 6 days a week, 12-hour days. So it definitely will give us the ability to really expand when vaccine is here. So we're excited and looking forward to that. And then other question was?
Question was just the other different sites other than the two. I mean, I think they're both the Rosinger Arena and the Arc are pretty accessible, but there may be, like we did the one at Mount Pisgah. Are there other locations that you've looked at maybe to try to hit some of the communities that are less able to get out and about?
Yes, so a big focus for us going forward is going to be the rural communities also. So that's where we've got these mobile teams through the Guard that are available to us and can go out. So 2 of the teams that are here are mobile teams and can be deployed to different areas of the county. We're looking at some other things on the west side, and I think asking about how many, we did a little over 200 at Mount Pisgah, so that's really exciting. So hopefully I will be able to have a more concrete plan of exactly where we will be. That's my goal, is that we will know exactly where we will be each week with those mobile teams.
Go ahead.
Carla, I was thinking this is a good time to also acknowledge our community partners who have stepped up to help get appointments made for people to get their injections. I know there's a whole team of people from United Way that's working on this that, are they're volunteers. They're sitting at home with their phone and taking phone numbers and working the system to try to find a spot. So those that are computer literate can help those that aren't. And it's a community helping a community. So I'm grateful for them.
Susan, yeah, and thank you for mentioning that, Sonia, because I think we're all grateful for all the help that we're getting folks signed up for the vaccine. Go ahead, Susan.
Yeah, I don't know if you're ready to say this or not yet, Jessica, but I know that there's a lot of questions on 1B+. And so with the extra doses and stuff like that, are we going to be ready to move forward on that?
So in my packet, we've got a date that we're looking at. We're about 55% of 1A, 1B have received at least their first dose. So a little bit of this will be dependent, like my report says, on how many doses we're getting as a county, of how much more progress we can make. That March 22nd week is kind of that kind of moving target, if you will, of if we can get there, will that be the day that we can move forward? So we hope to have a better answer next week so that we can let the public know if we're ready or if we're not ready.
Question.
Go ahead.
Yeah. Is there any
Jessica and I
evidence?
have to be. Oh, sorry, go ahead.
I'm sorry.
Jessica
there
and I
any
have to be
evidence?
muted.
I don't know what's going on. Is there any evidence that people need to present when they're saying they're in that extended 1B area? Do they need a letter from their doctor to say I'm a diabetic, or they just declare they are? How does that work?
So there are some items that IDPH has outlined. I don't have them in front of me, but I believe there's 4 different things. I think you can bring a prescription. So I don't want to even mention them if I'm not 100% sure, but there are some items that can be used for the proof.
Gotcha. People want to know that as they go on. Thank you.
Any other questions about her report that's in our packet or about the behavioral health program report? Judy, go ahead.
Okay, thank you. Well, I'm just all about handing out compliments tonight, and isn't that wonderful? Jessica, first of all, in the midst of so much uncertainty in terms of the dosages that you receive, contrasted with how prepared you are to move forward, I really applaud you for maintaining our trajectory and able to move forward, because it has not been easy. You're sitting on the edge of your chair all the time, just ready to go. So congratulations for keeping us moving forward. And then secondly, as I read through the behavioral health reports, I was struck by and just wanted to acknowledge that the Center for Human Services continues with their school program in the midst of all of this going on. And that's sure is a credit. And they've gotten some very good, strong feedback. So it's just another testament to that embedded school programs and the value it's serving, especially right now when kids need that kind of support. So I'm just sending out a couple of kudos.
Thank you, Judy, and well deserved. Anyone else? Bob, go ahead.
Yeah, I would echo Judy's compliments. That's one thing I was struck by on, we're so consumed with the COVID taking over what we had to do day to day. And I was amazed at all the different programs of how the numbers are still strong and how many things are going on. One education question, I noticed on several of the programs, you could just fill in the gap where it gives the financial report. And on several of them, they talk about the program deficit, and then it says % Board of Health programming funding. And so when we have those deficits, could you just remind me where we fill that gap? How are they filling that gap on those deficits that are listed here on several of the programs? Go ahead, Hannah.
Thanks, okay.
Okay,
I was
okay,
trying
there's a lot of clicking. There's a lot of clicking going on down here. guys, so, you know,
Bob, what I was suggesting earlier is why don't we take that back to our committee and get the answer for you and that, because Amy will be there and she can answer. I was a little confused by the numbers there showing our grant is both revenue and an expense. So I don't know whether the implication was that all the money was used for expenses, but I think we can maybe drill down into that a little bit more for you and bring it back to the next meeting, if that would be okay with you.
Oh, yeah, I'm sure it's an accounting procedure that everything is covered, but I just want to have an explanation. Nothing too detailed, but just because there's a pattern, and I'm sure the pattern is covered, but it's not conveyed in this particular report. That's all.
Yeah, so we can probably just get a little bit more detail or tease out the numbers a bit more than what was in that report.
Yeah.
any other questions? Oh, sorry.
Just add, Bob, I will tell you that I know that the Center for Human Services in particular on their psych program has informed us over the years as we've gone through the application process that they rely on their fund balance or their reserves to meet any shortfalls. But that has typically been something they would budget in, so it's not clear why even in that case there'd be a deficit. So we'll look into it and get back up with you some more information.
Yeah, it can wait till next month. Thank you.
Thank you, Hannah. Anyone else have any questions for Jessica, comments? Okay, then we're going to move on to our action items. They are also in your packet. So starting on page 58 and 60 is approval amendment to the fiscal year 2021 full-time equivalent position resolution and appropriation transfer for Fund 107-0062.
I'll move approval.
Second, Judy. Any discussion or questions? Go ahead, Hannah.
Yeah, and just basically I want to be clear, this looks like the same position we were dealing with last month. Is that correct? It's just coming back to us now. And thank you very much for that, because that's what should have happened. Appreciate that. I just wanted to be clear though, in your memo, and I thought, well, is this just something that a typo, or there's a reference to two positions in your memo and there's only action on one, and I didn't know if maybe there was just something that should have been taken out, or
Go
was
ahead, sorry. Am I not muted? Oh, I'm not muted. Wait.
Sorry about that. Yep, it's just a typo, just an error. Just one position.
Any other questions? Are we ready for a vote? It would appear. Julie?
Dr. Ginsburg,
Aye.
Carla Pohl,
Aye.
Cory Tello,
Aye.
Hannah Eisner,
I?
Judy Buchanan.
Yes,
I don't see Richard Giannetti still. Robert Cole Hayes,
Aye.
and is it Dr. Scott Hume? Am I saying that correct?
Yes. Aye.
Thank you. Sonia Reese
Aye.
and Susan Schaefer.
Yes.
Thank you, everybody. Motion carries. Our next action item is approval of the Illinois Department of Public Health COVID-19 vaccine provider agreement. You want to explain?
I'll move
Sorry, guys,
that.
we need a motion. Thanks, Susan. Judy, second.
And I
Okay,
have a
thanks,
question.
Judy. Oh, yeah, I know. Hang on just a second, because I've got to click on.
No problem.
All right, go ahead, Judy.
Fine. Okay, thank you. Jessica, I'd like to kind of start with this, and that is, can I assume that our legal counsel at the county has reviewed this document? Because I think between you and them reviewing it, I'm generally much more comfortable with what what the direction is that we're going.
Yes,
So
they have,
good. Okay, so Chris has looked at it then? Good.
Yes.
Okay, thank.
All right. Anyone else have a question? A discussion? All right, Julie?
Dr. Ginsburg,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Yes,
Robert Kohlhaas,
Aye.
Dr. Scott Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Motion carries. Our next action item is approval of the limited data use agreement for the change agents to the underserved service education, otherwise known as the CAUSE grant. Do I hear a motion? Judy,
so
second,
moved.
Corey. And any questions, Sonia? No, okay. And this has also been reviewed by legal counsel. All right, I believe we're ready for a vote. Julie, if you please.
Dr. Ginsburg,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Yes,
Robert Kohlhaas,
Aye.
Dr. Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Thank you. Motion carries. And our last action item is approval of the Illinois Tobacco-Free Communities Contract on pages 73 to 118. Judy,
Move
move.
approval.
so moved.
Second.
Second, Sonia?
Yes.
Sonia seconded.
Mhm.
Hannah, go ahead.
Well, I must say it's nice to talk about something other than COVID. But I thought there was something in the past few months that indicated that this grant had been reduced from previous years. And I know in the past, we've started to look at some of these smaller grants and say, is it really more work than we are getting in terms of the money? It looks like there's a lot that's expected of us if you look at the scope of work for the grant. And a lot of which I'm happy to say, in my opinion, some of the smoke-free Illinois mandates are kind of become norm, not that people don't violate them. So I guess I wondered, I wouldn't oppose this at this point, but maybe as we go forward, maybe the next budget cycle to say, is something like this worth it for us by the time we have to administer it? So that's just question, comment. I would like to know if this is less than we have received in the past.
I believe it's actually a slight increase, not much, but a slight. So it's actually started several months ago. We're just now getting the contract to execute. So it's a slight increase that we were able to budget for.
Any other discussion? Oh my goodness. I just heard my voice down the hall. That's why I turned around. It's just a little unnerving. Any other discussion? All right, Julie, if you please.
Dr. Ginsburg,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Yes,
Robert Kohlhaas,
Aye.
Dr. Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Did she call you, Corey? Okay. Is there any other items for the good of the order? Yes, Judy, go ahead. She's a little quicker.
yeah, it's just an observation, but I wanted to share with all of you. As you're aware from some of the reports, Corey and I had a chance to work with a number of community partners and put together a webinar on COVID vaccine hesitancy that, by my take, was probably attended by over 90 people. What this has done is really reminded me and Corey too of this whole equity, health equity topic, and how much a part of it our work is, and the partnerships that we had a chance to introduce are just joining other partnerships. And I'm just really much more sensitive, I think, to the barriers and some of the health outcomes that we constantly as a health department look at, and the work that our staff is doing to address them, and the partnerships that we have, and those that I hope that you will join us as we look to increase, because listening has become a very big part, I think, of our education. And I, for one, have learned a great deal, and I'm appreciative of it. And it's helped me appreciate, even to a greater degree, the work of our McLean County Health Department and the importance of it in our community. So I just wanted to share that observation and thank all of you for being a part of that.
And thank the two of you for the work that you did. It was an excellent town hall. And the questions were great. The MC, she was outstanding. She did an excellent job. Hannah, did you want
We're
to?
just saying that because she's a nurse like you.
Oh, I didn't know she was a nurse like me. Well, no wonder. Nurses rock.
Yeah, she
Okay,
was from the
Hannah, go ahead.
Black Nursing Association. Yeah.
Yeah, and I guess as a segue, I noticed one, I appreciated, Carla, when you opened our meeting last month with a moment of silence for the people who've perished. And I would like to suggest that as a board, we continue to do that until we got this thing licked. I think it's just a good reminder to us all. It's still out there and it's still scary. And it certainly has affected many people. And to that end, I think there's an event on Friday at the Museum of History is sort of sponsoring, where the health department is involved in it as well, as my understanding, to mark the terrible 1-year anniversary of COVID and to place some flags on the lawn as a memorial. So I don't know if the health department has the information for the link to the event, if there's registration required, but I just want to make sure we all knew about that.
Yeah.
I think
I'm wondering, is Mary Ann available to share with us a little bit? Yeah, I agree. And I think it'll be pretty revealing for people when they go around the courthouse on Friday and see the number of flags, white flags placed all around the courthouse in the grass indicating each person that has been lost to COVID. So Mary Ann, maybe you can share with us a little bit about what's going on Friday.
Okay, yeah, they are having an event, and they just sent us the final lineup of it. And what I know is that they're going to be having some readings and honoring all the names, and then I'll also be giving an update on a speech that Jessica and I have been working on that really just lets them know where we were a year from now, where we are now. Very motivational, and really asking everybody to help us lick this by not giving up yet. A lot of people are relaxing their standards right now, and we don't want that. We really want to encourage everybody as kindly as we can to make sure that people continue to wear their mask and get tested and social distance, because we're rounding the corner, and we don't want to as one of our people in contact tracing said to me the other day, we don't want to throw the game in the ninth inning. So I thought that was beautifully put. So we're excited to be there. We'll be there on Friday.
What time?
It begins at 5:30, and it will be on the at the museum, the History Museum. That's the beautiful old courthouse in downtown. I know they have a rain location at a local Presbyterian church, just in case.
And it's in person or virtual?
It's in person. Yes. Yeah.
Outside.
Yeah, it's outside. Yes. It'll be socially distanced. They're also doing a food drive on that day too. Okay. All right. Thanks.
Thank you. Sure. Susan.
So I kind of screwed up because I forgot something on the county board stuff. Tomorrow morning, bright and early at 7 o'clock, Chairman McIntyre is giving the state of McLean County. And I think you can see that on the chamber Facebook page. I'm not sure how, because I got a link to the Zoom meeting. So, but you had to register for that, and that's too late now. But I think that you might be able to just watch it on the chamber Facebook page. And the other thing that I have that I'd like to ask Dr. Ginsburg and put him on the spot to ask, what are you seeing now? Because I know that if you look at Jessica's daily report on, we have more residents that are being treated for COVID, but not necessarily in our hospitals. And I didn't know how much you're seeing and the severities and things like that. So I just kind of would like your viewpoint right now.
Definitely much less. I was working in the hospital last week, and I only had to deal with one patient with COVID. The numbers at Broman, at least, are in the single digits for Broman, which at the height, we were in the 25 to 30 range as far as total number of COVID positive patients in the hospital. Now we're down anywhere from 4 to 7. So it's definitely significantly better. I saw an article in the Panagraph this morning, which actually I would probably agree with, that a lot of people, because of COVID last year and what it did to the hospitals, a lot of people put off elective surgeries and kind of put off their own health care during that time. And now they're coming to the hospital, so it's busy with other stuff at the moment. But yeah, I spent last week in the ICU, and I only had one COVID patient to deal with all week. I had plenty of other patients, but no other COVID patients. So yes, it's definitely, I would say from about mid-January to now, it keeps going. It's gone in a positive direction. It's kind of like every other piece of data you're seeing. On the other hand, spring break is here. Keep seeing those pictures from Florida. So we'll see what happens with that. But I don't know. I think Thanksgiving was bad. I don't think Christmas was as bad as Thanksgiving as far as a big bump afterwards. And then on top of that, the vaccines really started getting distributed right about the time of Christmas. And so I have lots and lots and lots of patients asking me about the vaccine, and I basically just tell them all to get it.
So because there's fewer COVID patients, is the morale and things like that of the especially the ICU nurses and doctors, is that improved? Have they felt more relieved or anything like that?
I think so, because a lot of it is because the staffing needs has gone down. When you're constantly running a full ICU, we don't, the nursing staff, for example, they don't base their planning on a full ICU all the time, because we generally don't have a full ICU all the time. But in the middle of that, we were, week after week after week, we had full ICUs. And so nurses were being called in a lot of extra time. And so the stress was really, a lot of it was from the extra hours. A lot of it was from dealing with the patients who you knew were going to die. I tell people that I signed more death certificates in November and December than I had the entire 2 years prior to that.
That must have been very difficult for you.
Well, it was a strain, and I was a little disappointed, I think, in the amount of support available at the time.
I'm sorry to hear that.
Well, I think a lot of us appreciate all the work that those employees that, that work in that field, the nurses and the doctors, and the stresses that they've had over the last year. I think that they're really more appreciated than I think sometimes they're being told, even though they're being told that.
And the respiratory therapist.
And respiratory therapists.
And let's don't forget the families that are feeling really isolated from their loved ones that are in the hospital, and they know they're dying, and they want so much to be with them. So that's a strain on everybody.
This has definitely been a year. Do we want to end our meeting with just a moment of silence? So let's just take a moment to think about the families and the folks who have lost their lives over the last year. Thank you all. Thank you, Dr. Ginsburg. We really appreciate you keeping us grounded as to what's going on. Is there anything else that's for the good of the order? My apologies to Judy because I forgot to put her on the agenda. But that worked. All right, then are we ready to adjourn? Everybody have a safe week. Sonia. Oh, you're saying bye. Sorry. Thank you guys for bearing with Jessica and I as we did our little technological dance back and forth with the speakers. So everybody have a great week.